Hello, I'm Dr. Stephen Castor. I'm the Chief Medical Officer at Menorah Medical Center, and I'm your host of House Calls, where we interview physicians from Menorah about topics that are important for those in our community. March is Colon Cancer Awareness Month, and today our guest is Dr. Lina O'Brien, who's a colorectal surgeon and master surgeon here at Menorah Medical Center. And we're going to be talking about patients who've been diagnosed with colon cancer and their options that they have regarding different types of surgery for that. Good morning, Dr. O'Brien. Thank you for joining us.
Nice to be here.
Right. So can you describe the procedures, surgical procedures that are available at Menorah for those who've been diagnosed with colon cancer?
Sure. Menorah is a center of excellence for robotic surgery, so the majority of colon and rectal surgeries that we do are done with the robot. And so that means that we're doing it minimally invasively, and the recovery is a lot better. So we do surgery for colon cancer and rectal cancer, as well as other disease processes in the colon.
So for those who have a surgery robotically, can you compare how much time they might be in the hospital with a robotic surgery versus a more standard open surgery?
Sure. The standard open surgery used to be a recovery of about a week in the hospital, and obviously a good 6-week recovery at home with a big incision and more pain and a longer recovery and just more time getting back to your normal activities. When we do it on the robot, most people are in the hospital about 2 to 3 days, and it's even more than that. When they do come back for their post-operative visit, most people are in no pain and have resumed their activities.
So you mentioned that Menorah has a center of excellence. Can you describe what that certification process is about and why that's important?
Sure. The Surgical Review Corporation evaluates different places for their degree of quality and the number of surgeries that they do. And so we went through a rigorous process when we achieved this Center of Excellence. So they looked at the number of surgeries we did, our outcomes, whether we were providing good quality care for patients, and we met those expectations, and we're maintaining those as well.
So can you tell us just yourself about your robotic experience, perhaps how many robotic cases you've done in your career?
Certainly. I've done close to 700 cases at this point. I trained in an era where all I did was open surgery, and then we transitioned to minimally invasive surgery, and now pretty much everything I do is on the robot.
Mm-hmm. And again, just even though patients get out of the hospital quicker and have recovery quicker, why else do you like robotic surgery compared to the open surgery?
Well, it allows for much more precise operating. You get better visualization of the things that we're operating on. And the benefits to the patient are amazing. Smaller incisions, less pain, less site infection.
Okay. Menorah also is a leader in enhanced surgical recovery, and I know that you participate in that as well. Could you maybe provide a summary of that program for our viewers?
Certainly. So enhanced recovery after surgery is looking at a lot of different things to make surgery go smoothly, to have less complications, less pain. And so part of that is, in addition to general anesthesia, all of our patients get a nerve block, so they're not as much pain after surgery. We use a lot of non-narcotic pain relievers. We look at things that will allow patients to recover better, to have less infection, so that involves getting up and moving around, starting their diet soon after surgery. And all of that has been shown to decrease infection rate and length of stay and less pain.
Great, awesome. Great. Well, that's all the time we have for today. Dr. O'Brien, thank you very much for joining us. And again, March is Colon Cancer Awareness Month, and if you have not had your colon cancer screening, please check our website at menorahmedicalcenter.com or discuss with your primary care physician. Thank you for joining us.